Let's bring in Dr. Amish Adalja. You've advised the U.S. government on developing health guidelines, and you're a senior scholar at the Johns Hopkins University Center for Health Security. Thank you for coming on tonight.
Thanks for having me.
We've now seen a few variants of COVID since the pandemic began. Omicron won't be the last. Can you help us understand how variants will evolve and how we'll manage it?
When you think about SARS-CoV-2, the cause of COVID-19, it's really been generating variants since it first jumped into humans. That's what viruses do. Most of those variants don't make headlines because they don't really change the behavior of the virus. But what happens is, over time, the virus is going to be under pressure to try and evade some of the antibodies that our vaccines provide, that our immune system provides after infection, that our monoclonal antibodies basically are. So there's going to be pressure to mutate, to get around that. That's normal. And what will happen is, of those viruses, some of them may be able to do it, like Omicron, and be able to reinfect us if we've had prior infection, or get around some of the protection that our vaccines provide. So it's basically a struggle of the virus trying to have its genetic material copied, and at the same time, evade the immune system and go from person to person. So there are many forces on a virus that are pushing it to evolve to be able to remain in our population, to push it to be able to transmit efficiently, even when there's immunity.
What do we know about the evolution of variants? You just touched on that, but if we see new ones, are they likely to be less severe, or could some pop up that are much more severe?
In general, when you're looking at a respiratory virus that transmits when people talk or cough or laugh or sing or kiss, what facilitates the spread of the virus is people being able to go about their activities of daily life and then spread the virus. So in many ways, that would favor less severe infection, because if you've got a virus that spreads through the respiratory route and needs to thrive on social interaction, and you're stuck in your bed or you're hospitalized, you're not going to be a very efficient transmitter. So many respiratory viruses do evolve towards increased transmissibility and decreased symptoms. And remember, SARS-CoV-2 is a coronavirus, and we have 4 other coronaviruses that cause about 25% of our common colds. I think what we'll see is this virus take steps to become like its other family members, meaning it can reinfect us, and it usually causes mild illness, so mild that we go about our activities of daily life and infect other people. I think Omicron may be the first step down that road. We'll have to see what happens. I think it's unlikely that we find something that is more severe in terms of its symptoms when you're talking about a virus that thrives on social interaction for its transmission.
Mm-hmm. The World Health Organization says it wanted every country to vaccinate 40% of its population last year. That hasn't happened, of course. How do we go about bringing up those rates, especially in countries around the world that don't have access to vaccines like we do here in the U.S.?
We have to continue to think about this pandemic globally, because if it's burning out of control in certain parts of the globe, it puts the rest of the globe at risk. And you have, for example, in the United States, this push to put booster doses into almost every person that's been vaccinated. And I think that type of thinking has really stymied the way that we think about this in a global manner. Because when you think about what we're trying to do with the virus that can't be eradicated, that can't be eliminated, it's to shift disease towards the mild side. And what shifts disease towards the mild side is first and second doses. So I think we have to take a step back and re-articulate our goals and really think about, do we really need to be boosting healthy people who are at very, very low risk of severe disease, in which the vaccine, the standard doses, are keeping them out of the hospital? And I think that's what we have to really come back to, is what we're trying to do is remove this as a threat on the planet. And that means prioritizing first and second doses wherever they're lacking.
The flu is considered an endemic disease, like we saw in that piece at the top of this segment. And every year we tackle new strains of the flu, but it's not putting us in a kind of lifestyle like COVID has, right? Is that where we're heading with COVID? And in your opinion, when could that be what our lifestyle looks like?
I definitely think that we are heading towards transforming COVID into a disease much more like influenza, much more like other respiratory viruses that we deal with year in and year out, because of our knowledge, because of our tools, because of our vaccines, because of the immunity in the population. To me, what would mark that transition is when we stop hearing about hospitals worrying about capacity. We know that flu can get bad. We know that flu can put some stress on hospitals, but we don't hear about them really worrying about their capacity to actually operate. And that's happening still in some parts of this country. So that to me is the turning point. When we have enough immunity in the high-risk population groups that we don't have hospitals worrying about their ability to staff their ICU or take care of patients, or where they don't see ballooning emergency department wait times. All of that would be that transition. And I think maybe this will happen after the country gets through this Omicron wave, because so many people will have been infected. And by that time, we likely will have more of the oral antiviral, more monoclonal antibodies, more rapid tests, so more tools. So I think we're getting there probably before the end of the first half of 2022 would be my optimistic goal.
What will life look like if COVID does become endemic? Will we still need to get multiple vaccinations every year? How do you see that going?
It's inevitable that COVID-19 becomes endemic. That was clear back in January of 2020 when we had an efficiently spreading respiratory virus that had an animal host. That means it's going to become endemic. So when it becomes endemic, what that will mean is that there's going to be a baseline number of cases, hospitalization, and deaths. There's going to be hotspots. There's going to be flares that occur. But what we won't hear about are hospitals getting crushed. And when it comes to vaccine policy, I think it's too early to know. Because again, this comes back to what our goals are with this virus. Is the goal to prevent all infections, or is the goal to prevent serious infections? Because when it comes to serious infections, for most healthy people, the 2-dose regimen of Moderna and Pfizer, or 2 doses of J&J, is enough to prevent severe illness, hospitalization, and death. And with these first-generation vaccines, I think that's a good goal. And we may be boosting high-risk individuals, immunocompromised people, because there's been some erosion in the ability of the vaccine to prevent severe disease. But I don't know that we're going to necessarily have a standard vaccine policy at this point yet, because we don't know exactly what science is going to give us in terms of second-generation vaccines, in terms of variant-specific boosters like the Omicron variant-specific booster that's being developed. I think it's too early to tell how all that's going to unfold, but it's important to know that the post-pandemic world is not going to be 2019. There's still going to be COVID around, but a much tamer COVID because of our vaccines and antivirals and monoclonal antibodies and rapid tests, and most of all because of our knowledge.
Let's talk a little bit about masks. There's a lot of confusion about masks. We keep getting told different things every few months. Now wear a K95 mask. Your cloth mask isn't going to help as much. Where do we stand on masks? When is that day going to come that we'll be able to take it off? Should we all be wearing the K95 masks right now as Omicron is surging? Guide us through that a little bit.
I think masks are eventually going to transition to a personal preference based on an individual's risk tolerance, that some people are going to continue to wear masks, especially in high-risk situations, whereas others are not going to wear masks unless they're asked to do so, maybe by an owner of a building. And I think what's clear is that masks do decrease transmission. And I think for a fully vaccinated person, the calculation is, am I trying to prevent myself from getting even a mild infection? And I think that's different, that threshold for each person. And clearly, KN95s, N95s, KF94s have more filtration ability, so they're going to be more protective, but not everybody feels comfortable wearing them. They're a little bit harder to wear than surgical masks. But what I think is important with the CDC guidance is that those people who want to wear a mask have a way to understand what types of masks are effective, which ones are less effective, which ones are more effective. But I think we are coming to a point in society where we're thinking about off-ramps for masking. And certainly half of the country doesn't really have mask mandates in place at all. So really what we're trying to do is give people tools so that they can risk calculate a world in which COVID-19 is present. And for some people, especially those with high-risk conditions, they may continue to want to wear a mask. But for others, they may go to not wearing a mask. And I think we're going to be at different points in different states. And ultimately, this is going to be something about what risk is acceptable to the individual who's deciding whether or not to wear a mask.
Should the advice have been to wear a K95 mask all along?
So when it comes to what level of mask protection is necessary, I don't know that that's the best way to have gone about it, because early on in the pandemic, we clearly did not have enough of the respirators, the N95s or KN95 equivalent type of respirators for healthcare workers. And I think that had to be the priority. But I think that it was clear to tell people, it would have been easy to tell people at that time that if you want more protection, these offer more protection. It may not be necessary. And again, in the new CDC guidance, they talk about the fact that the best mask is the mask that you actually wear appropriately. And as I said earlier, some people cannot wear a KN95 because it impedes their breathing so much that they don't feel comfortable, so they wear it under their nose, and that's not really helpful to anybody. But I do think that being clear about what types of masks offer what level of protection early on would have helped some of the confusion on masks.
Okay, Dr. Amish Adalja, thank you so much for your time.
Thanks.
Up next,